Hi everybody, this is Darius Kohanim, your personal insurance consultant, and it's Medicare open enrollment season, or Medicare annual enrollment season, which starts every October 15th through December 7th every year for anyone that's already on Medicare. So you'll notice a ton of Medicare commercials this time of year, and so I just kind of wanted to make a quick video for my clients to share with their family and friends, and give everybody a heads up on what's going on with Medicare open enrollment this year and what to be on the lookout for. So the first thing I wanted to bring up is to protect your Medicare number. It might be obvious for some of you, but I keep running into this with clients. There's a lot of scammers out there. A lot of my clients are getting tons of Medicare phone calls all the time, especially this time of year. And so you want to protect your Medicare number. You want to treat it like your Social Security number. You wouldn't email out your Social Security number. You wouldn't text me your Social Security number. And so you want to treat your Medicare number the same way. If anyone is calling and asking for this number over the phone within the first few minutes, run the other way. They don't have good intentions. So you probably even want to report that to the Medicare fraud department, which is just 1-800-MEDICARE, and look at the number that called you and report it. But no one needs your Medicare number unless me and you are doing an application for Medicare insurance, or you're at a doctor's or hospital's office, then yeah, they're going to need your Medicare number. But outside of that, no one else needs your Medicare number. So protect it, treat it like your Social Security number, and keep it out of the hands of scammers. Now, what would Medicare open enrollment season be without the lovely Medicare commercials that everyone loves so much? They're flooding the TV every time, especially if you watch the news this time of year. We got all types of celebrities like Joe Namath, the old famous quarterback for the Jets, and William Shatner, Captain Kirk from Star Trek. And they're all telling us we need to do something and we got to get the benefits we deserve, right? All this kind of talk. But there's a couple things that are not telling you, so I wanted to kind of bring that up in the next slide here. Maybe what to look out for and what plans are they actually talking about. So the two main plan types out there are the Medicare Supplement and the Medicare Advantage. And I just kind of broke down, there's good and bad on here for each one, so I'm going to get right into it. The Medicare Supplement starts out at about $100 to $150 a month because you're paying that insurance company to cover the 20% of your Part B as in boy medical expenses of Medicare. So Medicare covers 80% of your medical expenses already. It's up to you to cover the 20%. Otherwise, the Medicare Supplement will do that for you, and that's why there's a cost to that. So you have a monthly fee. Most of my clients start out at $100 to $150 a month. It covers the 20% of your medical expenses, but your plan does go up each year because you're a year older and medical inflation. So the Medicare Supplement plan with any company is going to go up every year. And I prepare my clients for 7 to 15% rate increase every year. In my opinion, that's good to normal. There's other companies out there that do a lot worse. So over my 16-year career, I would say that's kind of what I set my clients up to expect. What you're paying for is your maximum out of pocket this year in 2022 on the Plan G is in green, which is the most popular plan this year for the Medicare Supplement. Your only deductible would be $233, and that would be outside your physical exam. So if I had a heart attack, if I had cancer, I'd only pay $233 for the entire year at the doctor and hospital. And so that's what you're paying for. There is no dental and vision, and there is no hearing coverage with Medicare Supplement or Original Medicare. They just don't help me clean my teeth, eyeglasses, or a hearing exam. Now with the Medicare Advantage, it doesn't cost you anything because it's not a supplement. Where the commercials make it seem like it's just adding on some extra benefits. It's not. So the Medicare Advantage, I don't pay anything a month, so it's going to save me the monthly premium that I'm paying for the supplement, $150 or more. And it does not cover the 20%, so I'm going to have co-pays for my medical care as I go to the doctor, as I go to the hospital, if I ride in an ambulance, and so on. Rate increases, don't have to worry about that because it doesn't cost me anything. So it's a zero monthly premium still, so it's saving me money there each month. And then my potential max out of pocket per year, and this is what the commercials don't tell us, is they never mention what your maximum out of pocket is, and that's what I wanted to bring up today. So your max out of pocket on this is $4 to $8 grand per year per person on any of these Medicare Advantage plans on average. None of them are going to be way different from the other. If something happens to me and I'm on a Medicare Advantage plan, I'm going to be out of pocket thousands of dollars potentially if something major happens. But the copays, in retrospect, are actually pretty small, so it would have to be something pretty big for you to hit your max out of pocket. But of course, these commercials don't tell you that, and so I just wanted to make everybody aware. The nice thing, of course, the celebrities are, they got Joe Namath, and maybe they give him a lot of copy. There's some of these commercials, in my opinion. But Joe Namath is hyped up about the extra benefits. You know, to get the dental and vision, hearing, and fitness programs that some of these plans offer that, you know, at no additional cost to help cover some of the costs with dental, which is a big one with a lot of my clients. So there are some nice advantages with the Medicare Advantage, but it's not the same thing as a Medicare supplement. It's not like we're adding on dental and vision to a Medicare supplement. There's two types of plans. So here you go. The breakdown's on the screen. Hopefully that helps make it a little bit easier. And all right, so if you have any other Medicare related questions, or we need to do a free annual plan and rate review together, compare your plan to others, this is the time of year to do it. So I got my number at the top of the screen. You can shoot me a text, shoot me an email there. There's a link to my calendar at the bottom of this email and in the description here on YouTube. So we can compare your plan to others and just do a rate review, make sure we're not overpaying in certain areas, compare the Medicare supplement and Medicare Advantage plans, and the Part D prescription drug plan. But I'll say this, if you guys are happy with your coverage, we don't need to do anything. So I know the commercials make it seem like we need to put out a fire every year. If you're happy, don't do anything. Put your feet up, enjoy. Give me a call if you need me. If we do need to talk about other products, long-term care picks up where Medicare leaves off. You're only covered for 100 days on Medicare, so after that you're on your own. Home health care, assisted living, and nursing home can get very expensive, so that's where long-term care can come in. For my clients that are still working, disability protects me if I'm not able to work anymore and replaces my income, so income replacement. And then dental and vision is very popular this time of year for anyone that's on original Medicare. I do a lot of retirement planning. This year especially, been doing it more and more because the market's so up and down in the stock market. My clients are tired of losing money. So all the plans that I offer for retirement planning protect you from any losses. So I can honestly sit here and say that in my 16 years, I've never lost a dollar for a client when it comes to retirement planning. So I do have some tax-free retirement plans as well. So if we need to talk about anything there, I'm happy to do it. I also do a lot of living benefits, which is actually what I have on myself and my wife. So it's a new type of life insurance that will pay me if I pay my wife if I pass away. But if I have cancer, heart attack, stroke, disability, I'm self-employed. I'm not going to be able to work for a while if that stuff happens. And so I can get money out of my living benefits life insurance policy to help pay my mortgage, to help pay my business while I'm down and out recovering from major heart attack, cancer, stroke, whatever it is there. So there's a lot of different ways I can get money out of it. If you have life insurance now, most likely you're on the old type of life insurance. It's only going to pay if you pass away. So there's a lot of different ways you can see money from this thing versus the old way. So, and then I'm certified for anyone under age 65. Maybe you have family that's not on Medicare yet, or have family that needs health insurance. I help plenty of clients for the last 16 years for health insurance. I'm certified for all the Affordable Care Act plans. And then the nice thing is that I do have a few options that are off of healthcare.gov. So if you're unhappy with healthcare.gov and you're not getting a subsidy where they're helping you pay for your insurance each month, then I do have some other options off the marketplace that might be more affordable and might help you out. So I'm happy to talk there. So thank you for tuning in. This is the first video that we're doing here. We'll be doing more of these moving forward. My wife is helping me out with some of this stuff too moving forward, so it's great. And I will say that if you're happy with my service, I am self-employed. So please send out my name and phone number to anyone that's complaining about their Medicare coverage. You may have questions about Medicare or health insurance or life insurance, or any of the things you see on the screen here. You can hand out my number like it's free ice cream to any of your family and friends, because that's how I make a living. And I do get a ton of referrals every year. I'm very thankful for all of you guys that have sent me referrals already. Keep doing it. I take care of them just like I've taken care of you. I keep in touch with my clients every single year. All the sales guys you never hear from again. So if you have any questions, give me a ring. We'll catch up. If not, thanks again for tuning in. We'll be in touch soon. And again, be on the lookout for these scammers. Don't hand out your Medicare number, and just stay aware out there. All right, thanks a lot. Bye-bye.